You have a fibular nerve neuropathy. One doctor told you that you don't need surgery, another doctor said you need to operate as soon as possible, and now you're completely lost? So stay with this video until the end because you'll get all the information you need to undergo your treatment in the best possible way. First of all, the fibular nerve is the one that comes from the sciatic nerve, and it is responsible for lifting the foot and providing sensation to the lateral part of the leg and the top of the foot. Regardless of the cause of your injury, whether it's due to compression, an accident, or surgery, you need to determine whether there is a chance for improvement or not. How do we identify this? Through a consultation with a specialist. The specialist will order some tests that are extremely important for you to understand the degree of injury and whether it will improve on its own or not. Among these tests, we have electromyography, which can identify signs of reinnervation or not over time, and MRI or ultrasound of the nerve, which show whether the nerve is ruptured, severed, or even compressed. Alright, we haven't identified any signs of reinnervation, my nerve is compressed, and my foot hasn't improved at all in the past few months. How long do I need to wait and continue physical therapy before I should understand that surgery is necessary? Guys, if it's already been 3 to 6 months without significant improvement, or if your electromyography doesn't show signs of reinnervation, or if the nerve appears severed on imaging exams, then surgery is indicated. How is fibular nerve surgery performed? Let's go straight to the cause. If your nerve is compressed, only a nerve decompression is performed, especially if your symptoms of muscle weakness have been present for a short time. If your nerve is severed or your injury was very severe, simply addressing the nerve itself may not be enough for you to achieve the result you expect. In this case, we perform nerve surgery as well as a tendon transfer, the posterior tibial tendon, which is the tendon that turns the foot inward, so that you can have more strength to lift your foot. These procedures are performed under general anesthesia, last about 2 hours, and you can be discharged from the hospital on the same day. If only a decompression of the fibular nerve is performed, then you can leave already walking and moving your leg without any restrictions. If a reconstruction of the fibular nerve or a tendon transfer is performed together, immobilization with a plaster splint is necessary. What is the recovery like after fibular nerve surgery? First of all, if you had tendon transfer surgery, you need to wait 30 days with the cast before you can start walking and doing physical therapy. Otherwise, if you only had a nerve decompression, you can start walking and physical therapy immediately after the operation. The necessary medications are antibiotics to prevent infection and also pain medications, because some of these procedures cause discomfort, and it is very important to control pain in the immediate post-operative period. Of course, this is a surgery that is performed with stitches to close the incision. These stitches are removed 14 days after the procedure. What are the risks of surgery for fibular nerve compression? Like any procedure, it carries the risk of anesthesia, the risk of infection, and the risk of not achieving the result you expect. Therefore, when you undergo the procedure in a reputable hospital with a doctor who understands and specializes in the subject, your chances of complications are much lower. Don't give up on treating your fibular nerve injury. If you want more information and want to learn more about nerve injuries and foot drop syndrome, like this video and follow our channel.